Action?
Mm-hmm.
Okay. Right atrium and left atrium. The auricles are out here, so the right auricle, this folded part, and a left auricle, and a right ventricle, the space, and a left ventricle. We got the inferior vena cava here. Pulmonary trunk right here. And then it branches, see each side. So we have the right and left pulmonary arteries. And then we got to come back here in red, our right and left pulmonary veins. So of course right and left sides. Ascending aorta. Ascending aorta. The aortic arch. And it curves. Descending aorta. Coming off here, right at the arch, you have here brachiocephalic trunk, left common carotid artery, left subclavian artery, anterior interventricular sulcus. So we're really looking at the groove. The problem is these blood vessels are sitting in that sulcus. They're sitting in the groove for the front. Or same thing on the back, you got these blood vessels here sitting in that posterior interventricular sulcus. It's sitting in the groove, so really covering it. Coronary, left coronary artery. So of course, you know, this is the left side. Left coronary artery, and coming around, left coronary artery, when it goes this way, you got the circumflex branch. And when it comes straight down, you have the anterior interventricular branch. The right coronary artery, so kind of you see more of it here. And you follow it around, and then you get back here, and you see it's dropping down. That's where you have this next one, the posterior interventricular branch. But it starts here at the right coronary artery, wrapping around to the back. Great small middle cardiac veins. Okay. So you notice here we're on the right side. We got the small cardiac vein. From the left side, the great cardiac vein. And right here, that middle cardiac vein. Small, middle, great, they all merge together. This really big one here, that's the coronary sinus. Come around to here. You see the arch of the aorta, the pulmonary trunk, and this is where you see the, what do we need? Ligamentum arteriosum. My fingers are in the atria, and what separates it is the interatrial septum. Here we are in the ventricles, and what separates it? The interventricular septum. You got the tricuspid valve, the pulmonary semilunar valve, the bicuspid valve, the aortic semilunar valve is up there. Follow the tri and bicuspid valves down, and the little stringy part is the chordae tendineae. And then where it attaches to the ventricle, these are papillary muscles where it attaches to the ventricle. So AV valve, chordae tendineae, papillary muscle. The rest of the muscle in the ventricle branching all around. Trabeculae carneae, all the branching, all the other branches. And the layers of tissue. Endocardium just means the inside surface. Myocardium's the muscle. And then epicardium's the outside surface. It's time to dissect the sheep part.